Hello everyone, today our topic of study is about dysmenorrhea. Dysmenorrhea can be broadly classified into two types: primary, physiological, dysmenorrhea and secondary, pathological, dysmenorrhea. Primary dysmenorrhea is usually due to the physiological structure of a woman's reproductive organs. For example, some women who have not had sexual intercourse may often experience dysmenorrhea due to a thicker or more intact hymen. This condition usually alleviates after they have had sexual intercourse. Another type of primary dysmenorrhea occurs because of changes in the structure of the reproductive organs, such as a septum in the uterus or a pathological ring in the cervix, which makes it difficult for menstrual blood to be discharged during menstruation, thus causing uterine pain. Secondary dysmenorrhea, which is more common, can generally be divided into two types: cold dominant type and qi stagnation and blood stasis type. The cold dominant type of dysmenorrhea often results from not dressing warmly enough or excessive consumption of cold drinks or raw, cold food, leading to poor microcirculation in the pelvic or abdominal cavity, ultimately causing incomplete shedding of the endometrium and dysmenorrhea. The qi stagnation and blood stasis type of dysmenorrhea often arises from emotional instability and irritability, causing flank pain, abdominal pain, or stomach discomfort. This type of dysmenorrhea worsens when emotions fluctuate or become irritable. For these two types of secondary dysmenorrhea, we have several suggestions. For those suffering from cold dominant dysmenorrhea, it's important to keep warm and avoid contact with cold water or cold environments during menstruation or in daily life. For those with the qi stagnation and blood stasis type of dysmenorrhea, in addition to regulating emotions and avoiding excessive excitement, it is possible to unblock the meridians and apply acupoint therapy, such as in acupoints like the Yaoyang Guan, Bao Yao, Qihai, Guanyuan, Sanyin and Shuihei. For dysmenorrhea caused by coldness in the body or coldness in the entire pelvic cavity, apart from keeping warm, it is necessary to develop the habit of soaking feet. As the saying goes, to warm people, start with warming the feet, and cold enters from the soles of the feet. The colder the feet, the greater the chance of dysmenorrhea. Developing this good habit can effectively improve dysmenorrhea. Additionally, dysmenorrhea can also be caused by uterine fibroids or adenomyosis, which is a fairly common situation. Therefore, these women usually enter a state of tension and anxiety before their period arrives. Excessive tension and anxiety can also lead to premenstrual pain, and the pain during menstruation can be unbearable. For such situations, apart from providing emotional comfort, we also need to provide physical conditioning for patients with dysmenorrhea. Physical conditioning includes the use of some acupoint cupping, scraping, and regular moxibustion. The effects of these methods are usually fast and often immediately noticeable. In addition, we can also combine other acupoint treatments according to the patient's clinical symptoms. For example, if the menstruation is excessive and difficult to control bleeding, we will add Yinbai acupoints. If the menstruation is not smooth or the amount is less, or the endometrium is not completely exfoliated, we will strengthen the moxibustion of Qihai and Guanyuan acupoints, warming the entire lower abdomen area. At the same time, we will enhance Zushanli acupoints or Shuihei acupoints to promote the circulation of qi and blood throughout the body, effectively relieving the onset of dysmenorrhea. During menstruation, it is also very important to rest. If the rest is not good, it will lead to qi deficiency, which can easily cause incomplete exfoliation of the endometrium. In addition, diet also needs to be paid attention to. During menstruation, we should drink more hot soup or hot water to promote the metabolism of pelvic fluid and frequent urination. There are also other gynecological diseases, such as vaginitis, endometrial thickening, inflammation, adhesion, etc., which may reduce the contractile ability of the pelvic or pelvic floor muscles, or cause problems in the urinary system, such as urethritis. We will answer each of these questions for you in our practical operation. Next, let's move on to the operational phase.